Let's study the types of fracture on the basis of displacement. So, the fractures are classified on the basis of displacement. They are the non-displaced fracture and displaced fracture. So, let's study the displaced vs the non-displaced fracture. Displaced or the non-displaced are the first words your provider will use to describe your fracture. And the non-displaced fracture can be seen in the image. Non-displaced fracture are still broken bone, but the pieces weren't moved far enough during the break to be out of alignment. So in the picture you saw, the fracture is there, but the pieces they have not moved far enough. There is no gap even though there is a break and there is an alignment disruption. In this image you can see there is a fracture but there is no displacement. Non-displaced fracture are easy to identify by the absence of significant displacement. So there is no displacement there. So in that we call it a non-displaced fracture. So what will be the displaced fracture? The displaced fracture, the fracture is there and the bonds have moved apart. There is a gap between the fractured bond. So in this image you can see there is a gap between the two bonds. So a displaced fracture means the pieces of your bone moved so much that a gap is formed around the fracture when your bone is broken. The factors responsible for the displacement is the fracturing force, the force at which the bonds are broken, the muscle pull on the fracture fragment, as well as the gravity. These are the factors causing the displaced fracture. Displacement can be in the form of shifts. So in the first, we can see yes, there is a shift, maybe angulation or rotation. The displaced fracture are much more likely to require surgery to repair. So most of the case, the repair of the displaced fracture require a surgery.